be on time. The second rule is, please put your mobiles on the switch off mode. And switch off, or you can put it in the vibration mode. And the third is that we will take attendance twice. And if you sign your paper and you are not there, then you will be marked absent for the day. And we will not give you credits for the course. Right? So don't just sign and go away. So that is this. And then we have the interactive discussions, which will be done in 4 groups. When you sign your sheet, you will have seen that in front of your name, your group has been defined. So we have divided you into 4 groups for group discussion. That is 1, 2, 3, and 4. Note your groups so that when we have that interactive session, then you know which group you belong to. Okay. Now we move forward and go to the second part of the series today, that is principle of ethics. Then I request you all to be quiet, please. Or someone wants to say something, is free to say something on the mic. You can use the mic and say. Okay, now we move on to the principle of ethics. Can anybody let me know what are the principle of ethics that you know? Dr. Rakesh already talked about it during his presentation. So anyone would like to revise the 4 principle of ethics? Justice, beneficence, very good. Benevolence is not part of the core principle of ethics as far as the patient care and research ethics is. It is one of an ethical principle, not a core principle of ethics. Justice is fine, beneficence is fine. What else? Autonomy. Good. Autonomy, right? And one which started with the Hippocratic Oath is left. Do no harm. That is known as good. So these are the 4 principles of ethics. And that is what we need to adhere to. And as we move along, we will look at these principles and see how they sometimes conflict with each other. So what do you understand by ethics? Anybody would like to say in simple words? This is not moving. No. In the layman language, how can we describe ethics? I think ethics is something which you are taught right from the beginning. When you, as a baby, you start understanding the outer world. In your family, wherever you live, wherever your schooling is done, ethics is just a part of life. It is nothing that we can teach you, or it can be taught at some point of your life. It goes all along as you grow. Right? You agree with that? So what do you think is ethics? The moral value. Right. So the moral value, what you have. So it is basically, I will try to understand it as something which is desirable and which is not desirable. That is how I understand as what ethics means. So it is nothing which is guided by law, but this is how we understand it. So if you look at the dictionary, it says the moral principles that control or influence a person's behavior. And when we talk about the medical profession, we talk about it as a code of behavior, which is considered to be correct for members of the medical profession. So the core principles, as you rightly said, are autonomy, non-maleficence, beneficence, and justice. Okay, what is autonomy? Right, good. So that is something you have a right to refuse. You have a right to say yes. So that means you have a right to take your own decisions. And as medical professional people in medicine, we have to give that respect to the person or the participant or the patient. What we are talking about here is not just a patient. We are also talking about a participant. You also enroll in different research projects where you have participants who are not patients. You have volunteers. So at large, you are trying to have a respect for people. So you're giving them right, the due right that they have. So basically, it means a respect for persons. So you want to honor the person's decision making, regardless of his or her choice. So the other important part of autonomy is that it is an independent and informed decision. So when a patient or a participant makes a decision as a researcher or as a doctor or as a professional person, you are giving the information to the person and then you are waiting for that decision, which has to be informed and independent. And it basically ensures voluntariness. So it is a choice to freely choose whether or not to participate in the research, whether to undergo a treatment, whether to undergo an investigation. So that is a part of autonomy. But what do you think is a basic line when you talk about autonomy? Everyone should have autonomy. But when we talk of research, when we talk of patient participation or treatment, what do we look for? We have this principle of autonomy respected. We look whether that person or patient or participant, whatever, has a capacity to make that informed decision. That is also an important part that you have to analyze. When you see a principle of autonomy. So that is the other part which is important. Okay. So as you said rightly, it is a respect that a patient can refuse a treatment or make a bad decision, which in his or her terms may be a good decision, but for your understanding, it is a bad decision. So that is what is autonomy all about. And auto means we know auto antibodies are self and in charge of the cell. So there is a participant, there is a patient, you give him all the possible alternatives, and it is a decision of the patient or the participant to agree or not to agree, whatever you are asking him to undergo. Okay, so basically autonomy means that the person in question is the most important one who will make the decision, not him, his family members, depending upon whether he or she has a capacity to do it. Okay, now we come to the other principle. What is beneficence? So the word itself explains beneficence means benefit. So you are doing something which is good for the participant or the patient. So you are acting in the person's best interest, not in your best interest. That has to be clearly understood, especially in research studies. You are doing something for the benefit of the patient at large. When I say at large, it may not be a direct benefit to that person who is enrolling in a study or otherwise, but at large for the community, you are trying to do something which will be good. It is not just your own benefit that you are thinking at that point of time. So benefit is in the person's best interest, who is a participant. So for a drug, you're planning to start a drug or you're doing something, a device or a drug trial. So what you need to see is what is the benefit risk ratio, whether risks outweigh the benefits or benefits outweigh the risk, and then you have to act accordingly. So you have to see that the benefits should be at large more than the risk which are involved. So let us come to an example. Who would like to read up? These are very simple examples, I think, just to put in the point across. Anybody in the second row? Wherever mics are working. Everyone is sitting like a statue. Right. So Department of Gastroenterology. Who is from the Department of Gastro? Is here? No one is there? Radiotherapy? We'll take the attendance later. To read up the one person can read up. Anybody knows how to read English?
A 55-year-old lady diagnosed as stage 2 breast cancer attends an oncology clinic. Her treatment options are told to her. However, she says that she is not.
However, she says that
she is not willing for any form of chemo, radiotherapy treatment at any stage of her management. The patient is in full capacity to make an informed decision.
So what do you think? What are the principles involved according to you? So the autonomy, that is the person's decision that he or she does not want to undergo any treatment. And as a professional, you are thinking of beneficence. That is, you're thinking that the treatment will benefit the patient and he or she may be treated. So what do you do? So these are 3 things that you can deal with. How do you deal with this? What do you think? Person who's sitting just next to the, what do you think is the right option to do? I respect your decision. We will not proceed with any further treatment. That is it. You said you don't want any treatment, you can go home. So second is, I respect your decision, but it is my obligation to tell you that this is not the best course of action. Right? You agree with it? Everybody agrees with the second option? And third, of course, is something when you, so I said, the patient is in full capacity to make an informed decision. So that is something which you need to remember. That the patient is capable of making a decision for his or herself. So that is why you will have to respect your decision. And it is my obligation to tell you that this is not the best course of action. So here is what is autonomy, and this is what is beneficence. Okay, good. Now we come on to the second, this side. Anybody would like to read up? So we had someone from that side, now someone from this side. Open your mic and read up. The checkered shirt, maroon checkered shirt, third row, with a specs. Yeah. Not working? You can speak loudly.
56-year-old officer with type 2 diabetes mellitus presents in the office with inability to walk and right foot pain. Physical examination and investigation reveal wet foot gangrene with poor perfusion of the foot. The foot is incapable of differentiation. The patient is determined. The patient has the capacity to make a decision. He refuses to get a foot and
Okay. So again, the same two principles are in conflict with each other. That is autonomy versus beneficence. So how do you think you deal with it? You're all, many of you are clinicians. So how do you think you deal with this? So there is a conflict between autonomy and beneficence in both of these examples. So what do you do? Let the patient go home, or do you try something? What do you do? Counsel, good. So you talk to the patient, you talk of the options, you reassure. So you try to understand why the person is trying to make that decision. So there may be a lot of issues, sometimes not just related to physical harm that the patient is thinking of. It may also be some psychological harm, from social obligations. So that is why you need to understand why the patient is making a particular decision. And this is true for research also. Empathetically, you can identify the emotions and the apprehensions and try to educate the person and then reassure. But we need to remember that the patient or the participant has the right to make a good or a bad decision. That right lies with them, and that is generally the final word. Okay, so non-maleficence, you already said is do no harm. Okay, so maleficence means harmful act. So do no harm is the word, and this is what was started with the Hippocrates oath. So it is basically the universal principle which guides healthcare in all systems of medicine. And when I say no, do no harm, it is not just we are talking of human beings. We are also talking of the ecosystem. We are also talking of the environment. Okay, so this is no harm to humans, environment, and the ecosystem. Okay, the center. Who will like to read up? Third row. Anybody would like to read up wherever mic is working? Or loudly. Read up.
A 40-year-old man presented with fetal edema and was found to have nephrotic.
So, what do you think? What are the ethical principles involved? You are trying to do a biopsy. So, this may, so you have something which is a benefit. You are trying to make a benefit. What else? So, you're doing an invasive procedure. This is something which is interventional. So, it will be. So, you're trying to do no harm. So, suppose the patient has problemopathy. Would you like to go back and look whether renal biopsy is really required to make a diagnosis? So that is when you have to look at both of these principles. So the patient is fine, you will think that the benefit is much more than the risk involved. Suppose a patient has coagulopathy, you will start thinking the risks are much more than what is the benefit of making a diagnosis, or you already are thinking of some diagnosis and you may like to treat that. So what I'm trying to tell you that every situation you have to think of the benefit risk ratio, and these principles you may not think about them, but they apply to your daily life whenever you make a decision, whatever you do. So basically, ethical principles involved are beneficence and non-beneficence. Okay. So what do you mean by harm? We said do no harm. But we should understand what is harm all about. To understand this principle of non-beneficence. What do you think is harm? For example, for this patient, if you are doing a renal biopsy, the harm will be if the patient has coagulopathy, it will be bleeding. But that is a medical harm. That is an adverse thing which can have a medical adverse event, right? What do you think other harms that can happen? Your daily practice also when you do something or you enroll in research. So one is physical harm. Good, very good, psychological. Financial, good. You're asking a patient to come again and again to the clinic for a research study. There may be some economical, he's using his daily basis. That is economical harm. Psychological harm will be something like you're giving something to a patient or you're divulging his details, you're talking about a psychiatric illness, that will be psychological harm. What else? You're absolutely right. Physical, psychological, you talked about economical, what else do you think? Social, very good. So what can be the social implications? Stigma associated in the community. So this is especially true when you do behavioral studies, you do social studies, you go to a community, you have to think about a lot of things. You're trying to detect tuberculosis in your you go to a community. Finding out that the patient has tuberculosis and then looking at the social aspects of it is also important. So these are the different types of harms. So what we need to remember that when we are talking in medical terms, harm does not only mean the adverse events which are medical in nature, which are physical in nature, but we are also trying to look for psychological and emotional harm. These are the examples that I am giving you. So suppose someone is participating in a study where memories of the traumatic experiences needs to be revisited. Social harm. So like something stigma that we talked about, stigma of diseases, HIV, STD, TB, mental illness, and so forth, and the others. Psychosocial. For example, you're doing a genetic testing. You detect a genetic abnormality which runs in the families. Okay, what will happen? It may cause anxiety, it may cause depression, it may lead to disrupted family relationships. They may have problems in their social arena. So these are all type of harm. Informational harm. You are divulging the confidentiality. Issues are there. When you enroll participants, you talk to patients. So there is a lot of information which is disclosed. And that is why when you have something like an ethical clearance, you're asked that you wish to maintain the confidentiality of all the data that we are collecting. Economical, you already said, and sometimes you may also have legal issues which come in with these. So that is why you need to remember what are the different harms which can occur and how to prevent them. Now let us look at an example. Comes back to the first row. Anybody from the first group? Someone at the last. Those who sit at the last will get the most. Someone at the end.
An 18-year-old boy with a road traffic accident is brought to the emergency department. He has to be placed on a ventilator for 9 to 4 and is later determined to be brain dead. The physician informs the family, who are the legal decision makers, that in his professional opinion, life-sustaining measures should be withdrawn. The patient family objects to the withdrawal of the.
So what do you think are the principles which are involved?
Autonomy.
At this stage, the capacity to make a decision like the legal decision, right? So family now has to decide. So the principle is autonomy. Good. One is autonomy. Other is beneficence. You are thinking whether ventilator is of any use, you will keep on lying on the ventilator. The third thing is, so the consultant or the clinician is also bothered whether he or she is doing a right thing. He has to weigh whether the recommendation that ventilator should be removed and the withdrawal of ventilator may cause some harm. So you have to outweigh whether what are the benefits of using it and what harm you can cause to the patient. So these are all key principles in play, and it is depending on the situation. There are a lot of factors which will determine how the clinician acts and what the family is told. Now we come to justice. So what do we understand by justice? It's a simple word. What do you think, justice? Treating people fairly, fair selection and distribution of benefits or risk to the participants who should be apprised about them. So you are trying to see that whatever resources are present, whatever you can do best for the patient is done properly and with equitable interests. So it has to be equitable, appropriate, both in participation in studies or in treatment. So it was once said that giving to each what is his or her due. Okay, second row. A physician notices that most research on strokes in his country is done only in men. Is this right? Do you think this is justice? Last row. Of course, the answer is no. So, what ethical arguments might you advocate for more research in women? Why do you think that more women should be enrolled? They're doing it in men. Do you think everything which is found out in the research study will be applicable to the women also? Why? That is the question. Right, because they may have different hormones. There may be different factors which are related in women as compared to men. Right, so that is why this is not justice. So ideally, both of them will be involved in the study. So do you agree in that? Okay. So this is about something which we have all undergone. This was about the COVID vaccine. So at least in our country, we had, if it would have been that only people who can afford the COVID vaccine are given that vaccine, do you think that would have been a justice? So it was given free of cost. So that is something which is justice. So whatever resources we had, it was given. It was, if you think of the COVID vaccine, it was given according to the age also. As it came in, as the resources started improving, you started opening it to more people who required it. So that was done in a staggered way. So that is total allocation of the resources in a justifiable way. So this is something which is required in medicine. Okay, so this is basically a distributive justice which we are generally talking about. So it is fair, it is equitable and appropriate distribution of healthcare resources determined by justified norms, right? So they may be in short supply, but you have to have a fair means of allocating them in the community. Of course, this is something which is very debatable because we have such a wide divide in different countries, within the country, poor and rich, what is affordable, what is not affordable, the best care. So this is something which we can keep on debating, but this is generally a principle which we should understand. So can someone tell me what is the difference? If you see, I've talked about justice and said equitable, not equal. What is the difference between equitable and equal? This side, now. What do you think can be the difference between equitable and equal? Because I'm saying it is an equitable allocation of resources, not equal.
Those who are recording will pay and those who are not recording will not pay.
No.
Equal is giving them the same opportunity. Equitable is giving a different opportunity as per the status of the patient. So the patient is economically background, so giving them more financial background as compared to the patient who are economically from the well-doing status.
That is what he said, but I don't think that is. Yes. So for example, I'll give you a very simple example. Suppose there is a family of 4 persons. You have 4 chocolates, right? You have 4 children and you have 4 chocolates. So what will you do? What is equal? 1 to each. You agree that is equal. But what happens that one of those children has type 1 diabetes. So what do you do? What do you do? Do you give that child unprompted? Because that is what is equal. That is what is equal, right? That is what you said. So you give that child also the chocolate? No. Right? So equitable means that what is in the right interest of the children. It is subjective. Now you understood that term, so you will not give the full chocolate to the child. So that is something which is equitable. Okay, let us now look at this. You understood what is equitable and equal now. Which row is now? This was the first row again. Someone in the center? I don't think people need to read that. Fourth row from the back. Anybody will read that? They're counting the rows. Some people are looking at the back and counting from 1 to 3. So anybody would like to read that? First row.
32-year-old
Okay, good.
The known medical history of acid disease, present in the emergency with bloating, upper abdominal pain gas. This concern had been followed. The physician examines him in the emergency waiting room and he waits in the room for 3 hours. As he's waiting, he sees other patients coming in the waiting room and being sent straight to the emergency department.
So what do you think? Is the ethical principle of justice being served for this patient who is forced to wait in the waiting room?
Actually, it is equitable to them.
Why?
Because his condition cannot be trial and if it doesn't be cured, can be.
Good. So maybe the persons who have been coming after him and have been taken to the emergency room straight away, maybe had severe conditions as compared to what he had. You agree? So this is this equal? No, it is not equal. He is waiting in the waiting room for 3 hours. And other patients are entering and going to the emergency department and getting treatment. But this is equitable. So the patient's treatment is not equal. We all agree. But it is equitable. That is what is justice that we are talking about. The patient may not think about it as justice, but as clinicians, we know that this is justice. So that is what is being talked about. So this is equality. Understood? Both of them have the same size of the ladder. This is equality. You get the same thing. But this is equity. That is, you give a person what he or she needs. So this is equity. So if you do everything equal, then it is not possible in medical science. You agree? So justice is equality, equally saying something is equal is same fair offering to everybody. So for example, for this example, if we look at it, everybody who is coming to the emergency department in the trial area is getting the same attention. So that is equal attention at the first point of interaction. Equitable is when you are not only dividing resources equally, but also factoring in differences between the people. So this is equitable. So giving that patient or participant what that person needs to achieve the best health care and not necessarily equal. So it is basically about distributive social justice. Okay, so this is what is the difference between equality and equity. You understood it? I don't think I need to explain. Okay, so after we know these four principles, I think all of you will have known by now. When we do research, it is important that these 4 principles then break up into 12 general principles. This is when we talk of biomedical, social, behavioral, any type of research, science research, which involves human participants, their material, their data regarding human participants. And these are the 12 general principles. And when you look at them, these are evident by the name itself. So, essentiality. You should understand that when you do research, it should be essential. That it is essential to involve that human participant in the research. That is why you're doing it for them. And it is essential to do that research. You need to see whether vulnerable participants are essential to be enrolled when you enroll them. And of course, we have been talking about it, it should be voluntary, non-exploitation, that you don't have your subordinate, that Dr. Rakesh showed you the examples that are taken up for the study. Social, you have to have social responsibility, social norms should be adhered to. You should respect the privacy and confidentiality. See that you minimize the risk as much as you can, and you should have professional competence. Sometimes when we look at studies, we see if the study involves some part of the research which the team is not professionally capable of doing it, then we ask them to add a researcher who will be able to do that part of the study. So that is also important, that you should have that professional competence to do that type of a research. And of course, maximize the benefit. And the institution as a whole will give you arrangement that that type of a research project can be carried out. So it should have the infrastructure to do that. Transparency and accountability, totality of responsibility. So the responsibility lies with all the stakeholders, the investigator, the sponsor, whoever is in the investigating team, and of course the regulators. For example, if it is a drug trial. And of course, environmental protection also comes into it. So these are the 12 general principles when you do research in human participants. Okay, so that was it. So